Aaron's exactly right. This is a super exciting day for us at Hamilton Health Sciences. So hello, everybody, and thanks all for being here for this announcement about a really super exciting future of diagnostic imaging at Hamilton Health Sciences. So I want to begin by saying we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. Now, there are a bunch of special guests here who I want to mention. First and foremost, the chair of our board, Charles Cremonesi, is here. Charlie, welcome. Richard Coruscant is here, is at the back. Richard is on our board of directors. Sevket On, VP and Zone General Manager for Canada Siemens. Dave Pasidi, President and Head of the Americas for Siemens. Brent Cruz, Head of Enterprise Services for North America Siemens. Really pleased that Anthony Dale, the President and CEO of the Ontario Hospital Association, is here. Anthony, welcome. Melanie Cohn, Director, Hospitals Branch, Ministry of Health and Long-Term Care. Really great that Melanie is here to support us from the ministry. Rosalind Tarrant, VP of Health System Strategy and Integration for Ontario Health West. I think I got that title right. So as many of you know, we've embarked on a journey to transform care here at Hamilton Health Sciences. And during the next number of years, we'll be taking a number of really bold steps to bring us closer to our vision of best care for all. Of course, this includes investing in modern tools and technology so that our people, our staff, physicians and leaders have what they need to do their best work for this community and for our patients. We're here today to celebrate a really major step in that journey. For years, the truth is we have not invested adequately in our diagnostic imaging equipment. Many of you here have experienced firsthand the impact of outdated, unreliable technology and what it does in terms of our abilities to provide great patient care. We knew that breaking this cycle of underinvestment was critical for us. We committed to making sure that our people and patients have access to reliable quality equipment for many years to come. That's why we pursued a management equipment services approach, which means engaging with a private sector vendor on the procurement, maintenance, and replacement of our fleet of diagnostic imaging equipment. So this is sort of like leasing a car, except the maintenance, insurance, navigation, and roadside assistance are all included in the contract. And the contract is actually considerably thicker than the one you might sign when you lease a car. I can tell you that firsthand. But at the end of the day, it means better equipment, less downtime, and more accurate diagnoses for our patients. This is a totally new approach to managing our very large fleet of diagnostic equipment. Over many months, members of our team from finance, diagnostic imaging, and many other teams, many other areas work to navigate this, I can assure you, extensive procurement process required to find the best match for us at HHS. And in that regard, I'm very pleased to announce that Hamilton Health Sciences has officially engaged with Siemens to transform diagnostic imaging services across our family of hospitals. We're really pleased to have engaged with Siemens in this new partnership. During the next several years, HHS will work with Siemens to fast-track the renewal of critical diagnostic tools such as X-ray machines, MRIs, CT scanners, which our teams and patients rely on every single day. Our relationship with Siemens will help us to keep pace with the newest, most innovative diagnostic equipment in our sector. Staff will receive training on the latest tools, and they will have 24/7 access to on-site support from Siemens to make sure this fleet of equipment is kept running smoothly. Our patients will benefit from fewer cancellations, shorter wait times, and better diagnosis. While this is a big investment in our long-term future, you can expect to see significant change even in the short term. Within the next 3 years, about half of our diagnostic equipment will be replaced. Within 5 years, almost all of our equipment will be replaced. And planning is already underway. We are taking a short break today to celebrate this wonderful news, but up until today and starting again tomorrow, the work will continue to make this a reality. So from my perspective, the future of DI at HHS is super bright. With that, I'd like to introduce Mr. Dave Pasidi, who I've had a chance to get to know a little bit over the past couple of hours, head of Siemens Healthineers for North America, to share a little more about this exciting venture. Thank you and welcome, Dave.
Hi, everyone. So great to see so many people here. As you heard, I'm Dave Pasidi. I'm very pleased to be here today and be a part of this incredibly important announcement. And this value partnership, as we call it, is a strategic alliance between Hamilton's Health Sciences and Siemens Healthineers in Canada. And it's really a critical transformation of care delivery for patients across southwestern Ontario. And we couldn't be more pleased and proud that Hamilton Health Sciences has chosen us to be a partner. I would say that we understand this is a bold agreement for both of us, and we take it very seriously. We're privileged and humbled that you guys have thought of us as a partner, and we understand the seriousness of it. And today is a day to celebrate, but there's a lot of work ahead of us. And hopefully, we're not just providing you new equipment, but hopefully we're helping operate things a lot better and hopefully much more efficiently than you have in the past. So we're excited about that as well. And we expect to learn a lot from each other. You guys are the clinical experts, so we're the technical experts, and hopefully together we can learn a lot from one another. We strive to forge strong and passionate partnerships like this, and this is the largest one we've done, so you know. It's only as a result of such partnerships that we better understand the challenges and needs of healthcare professionals. And when we combine these integral insights from our partners with our in-depth knowledge in medical technology and data analytics, it empowers us to engineer solutions that help healthcare providers deliver the best treatment possible for every patient. Together, we can innovate by taking a holistic view of the care pathway from prevention to diagnostics, therapy, and aftercare. And we are looking forward to this valuable partnership and the many positive outcomes it will create. So I really want to say thank you from all of Siemens Healthineers. We really appreciate it. Take care, everyone.
Thanks, Dave, and welcome to the whole Siemens team. We're really delighted to have you as part of our team. So I'm going to invite our most excellent interim Chief of Diagnostic Imaging, Dr. Karen Finley, to share a few words about what this partnership will mean to our physicians and staff.
Thanks, Rob. In my role, I really have an exciting opportunity to lead our department in transformative change. This partnership with Siemens is really going to do so much for our patients and our imaging teams and all of our hospital partners and colleagues. Imaging is really a key step in a patient's journey, from diagnosis to treatment to follow-up. We use diagnostic equipment in virtually every patient that crosses our doorway. It's really hard to think about someone who doesn't touch our department, our teams, or our clinical partners who work in imaging. And think about it, it's across the age spectrum as well. It goes all the way from neonates to palliative care. We deal with these people in our departments, and imaging is really central to the care of this very large population in an area of 2.5 million people that we draw from. This seems really points that Rob has highlighted about timely, reliable access to care, and along in partnership with Dave's comments about, the real spectrum of imaging we have from X-ray to mammogram. We've got, ECGs, EMGs, echocardiograms, intervention procedures, and lots of things that we probably can't even anticipate at this point we're going to move to as new imaging adventures. For staff and physicians, we're going to really know that we have the right equipment to use at the right time to really optimize our patient care. Our patients in Hamilton in this region can really feel confident that we're delivering the right tools to them at the right time. This project has involved a really close and intense diagnostic imaging and MDU and in nuclear medicine for your time and your enthusiasm. It's your engagement that's really made this a significant milestone in this whole journey. I would also like to specifically thank HHS leadership for their commitment to really move things forward and support us in a better vision for a sustainable future in diagnostic care. This is really an exciting time for Hamilton Health Sciences, and we look forward to working along with our partners in Siemens to realize the potential of what we can offer to our patients in this community and region through this great adventure. Thank you.
Thanks, Karen. I frequently say no successful organization can achieve its potential without three things. Everybody has to feel valued and respected. Everybody has to understand that they have a role to play as part of a big team and driving towards our mission. And we have to make sure our employees have, and our staff and physicians have the right tools to do their job. So we've been spending a lot of time on those first two things. The third thing has proved to be very challenging for us, but I think today we've made a huge step forward in making sure people have the right tools in order for them to do their jobs well. So this concludes our formal agenda for this morning. Thank you again for being here to share this great news with us. And please stick around. We've got some refreshments. We hope you'll stay and linger for a while anyway to reflect on this and to meet our special guests who are here today. So cheers, everybody. Thanks.